Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about colorectal cancer prevention and diagnosis. We're going to take a look from the family practice level all the way down to integrative oncology. So we'll start first with Dr. Gabrielle Givens, who's our first guest. Good morning.
Good morning.
Dr. Givens, I know that you are a family practice specialist and you work with St. Tammany Physicians Network, but tell me a little bit about your background.
I'm actually originally from Washington Parish, and I did my family medicine training with LSU, and I've been with St. Tammany for about a year and a half now.
Fantastic. Well, I'm sure you're as glad as the rest of us that we seem to be getting that pandemic behind us.
Absolutely.
And putting our focus on taking care of people. And of course, in family practice, your focus is very much on that, taking care of the whole family from very young to very old. Mm-hmm. And cancer diagnosis, I think, is a big piece of that. Mm-hmm. So can you talk a little bit about the role primary care plays in wellness screenings?
Mm-hmm. Primary care plays a really important role in wellness screenings. You know, we're the first point of contact for patients. We are responsible for their wellness exams, and that's what makes those wellness exams so important, is because that's an opportunity for us to talk with patients about what preventative health screenings are appropriate for them.
Okay, so if you think about it from our topic today, colon cancer, in your patient population, who's eligible for, because everybody doesn't need a colon cancer screening. So
right.
Who are we talking about?
So all adults over the age of 45 are actually eligible for colorectal cancer screening. I know that people typically think age 50 is, you know, that's when I get my colonoscopy, but they actually recently updated the guidelines to age 45. So now all adults over age 45 are now eligible. And we typically continue that screening until at least age 75.
Okay, so from 45 to 75, men and women, so that's really a pretty broad population of people. So colon cancer, I think, I know that for women, breast cancer is the most common, and for men, prostate. But when you take the whole adult population as a whole, colon cancer is the most common.
Correct.
And obviously, if the only risk factors we're going to say are you 45 years old and breathing? Okay, we need to screen. And we have a tendency to jump straight to colonoscopy, but there actually are a few ways that we can screen for colon cancer.
There's a couple different options. Colonoscopy is what typically people think of when they think of colorectal cancer screening. Now that's done by the gastroenterologist under anesthesia. It's both diagnostic and therapeutic, because if they find a polyp, they're actually able to take that during the procedure. Now, there are some non-invasive options for colon cancer screening. One is the FIT testing. It's not quite as accurate as a colonoscopy, but still a very good test. And the interval for that screening is actually yearly. And then there's also another at-home test that we use frequently, Cologuard. People have probably seen the commercials, those types of things. And the interval for that is actually 3 years. And you're able to do that in the comfort of your own home.
Very good. And so FIT testing, Cologuard, and colonoscopy, three completely different types of screenings. And you said FIT test annually, Cologuard about every 3.
Every 3.
And if you do a colonoscopy, that's once every 5?
So it actually depends on if they do find any polyps. If they don't find any polyps and it's a negative colonoscopy, you could be good for 10 years, which is nice for the patients.
Wow. Oh, that's fantastic.
Yeah. So it's on a patient-by-patient basis once they've done the colonoscopy.
That's really interesting. And I guess, like I said, most people, when you say colon cancer screening, they immediately think colonoscopy. And maybe there's a really good reason for that. If you're clear for 10 years or even 5 years if they find something. And the idea that having found something, they can take care of it right there on the spot.
Absolutely.
That's really exciting. So we talked a little bit there about what kinds of screenings we would do. But those are all proactive things that you as a family practitioner are going to say, you know, I come in for my annual, I feel fabulous, nothing's wrong with me. And you go, yes, but you're over 45 and female, so let's get, you know, these screenings done. What symptoms might someone be experiencing that would send them to come in and say, I'm kind of worried there's, symptoms of colon cancer. What are those?
Yes, so there's several symptoms of colon cancer. Some of the more common ones are changes in your bowel habits, or if you notice a discoloration or blood in the stool. Things like that should definitely prompt you to go see your primary care provider and discuss those with them.
Absolutely, because those could be colon cancer, but they could be a host of other things.
Correct.
Which is exactly why family practice is such a great place to start.
Absolutely.
Okay, and I think certainly we always talk about genetics in cancer, and in colon cancer in particular. So can you talk a little bit about that?
Yes, a patient's genetics are actually really important when it comes to colorectal cancer screening, in addition to, prevention. So if you have a family history of colon cancer, that does put you at an increased risk. Now, there are also hereditary forms of colon cancer. And so it's important not only to know what age the family member was when the cancer was diagnosed, but also what type of cancer it was, because depending on what type and age, we may need to start screening earlier.
Okay, so when you're doing annual physicals and wellness visits with your patient population, you're looking at things like that. So how old is my patient, male or female, what's their background, and then you ask that history.
Correct.
Because that helps you to know if my mother had colon cancer or my grandmother had colon cancer. Those are things that tell you something about what my risks are.
Yes, that's why I ask every patient when they come in for their wellness visit, is there a family history of colon cancer? Even if they're 18, I want to know, is there a family history? What age do we need to start your screening process?
Wow. Well, and I guess that brings up an interesting point about family practice. So talk a little bit about your patient population. Most doctors who are specialized are looking at a very discrete section of our population. But as a family practitioner, you see everybody.
I know. So I actually see ages 2 and up. So I take care of pretty much all ages, all the way up into your 90s and above. So, and that's what I like so much about family practice, is I get to see a little bit of everybody and everything. And my favorite thing is to actually take care of families. So I have several families where I take care of several generations, which makes family practice really interesting and fun for me.
I'm just thinking about that, not just from your family practice standpoint, but our topic today, colorectal cancer. If you're taking care of a family, then you're getting a family history that's really rich and very informed.
Correct.
And so from those risk factors, you are able to really know a lot about when to screen and what to watch for.
I know. I do have a bit of advantage taking care of families in that way, is because if one of the other family members is diagnosed with a new diagnosis, I know that that now is a risk for one of my other patients. So a little bit of an advantage in family medicine there.
I love that. And so as a family practitioner in St. Tammany Physicians Network, that enables you to take all of that information that you're helping that family with and use all the resources of this largest health system in West St. Tammany, so that when you do have someone who needs colorectal cancer care, they have all the resources they need in your own system.
They do. It's so nice working in this system because we have great help from the specialist, and it just really makes it easy for our patients to get the care that they need.
I love that. Well, Dr. Givens, thank you for coming in.
Thank you.
It's been a pleasure to have you on the show.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about colorectal health, and up next, we'll learn about specialty care and integrative oncology. We'll be right back.